Oh, you are turning on. You don't have to turn on now.
Oh, okay.
Just press pause. Okay, we see that lots of misunderstanding about mental diseases has been propagated nowadays by homeopath to look at the, though it is important part in the case history, but what Hahnemann tells here is little bit different. He began one-sided diseases topic. Uh, what number of aphorism? I think it is from 140. No,
Well, on 210, he mentions
no.
that in
He mentions this mental diseases from 210, but from 176 or 72, he talks about one-sided disease, right?
yes, 175. Let me read this really quick.
Yeah.
In one-sided diseases of the first kind, it is often to be attributed to the medical observer's want of discernment that he does not fully discover the symptoms actually present, which would enable him to completely sketch the portrait of the disease. So, number one, that there is failure of the practitioner to notice the symptoms. And then another reason why there can be a one-sided case, not just practitioner failure, but when other symptoms come forward and cover up the other symptoms. And specifically in a mental health case, when it's severe, the physical symptoms will recede to the background and the mental symptoms will become the presenting really big symptoms.
Tikwa, 1 minute. I need to tell you, in the right hand corner, you see view. You need
Mhm.
to turn on speaker's view because recording is from at your side.
You don't have recording today?
No, it's on your side. So you need
I did
to
it. I
turn
did it.
on
Got it.
speaker's view, right?
Did it. I thought you were recording and mine was only the security recording.
Okay.
Okay, so practitioner failure to notice the symptoms and or when there are such severe mental symptoms that the physical symptoms all but disappear.
Okay. Here, if you understand what is the meaning of this one-sided disease, it's just a very little presentation of main complaints, and there is nothing in relation with to explore more about the disease, that disease, a disease with one or two symptoms. That's all we get in the case. Okay. Now it has been classified by Hahnemann, or he told one-sided diseases has been classified into two types. One is internal diseases, and second is external diseases. Now, internal disease, he made another two categories. One is physical disease, and other internal disease is mental disease. On of earlier category, external disease, he put only one type of disease in external, and that is local maladies. Did you get the category? One-sided diseases under internal disease, physical and mental diseases, and one-sided diseases external type, there is local maladies. So we are concerned with one-sided diseases internal type on mental sphere, mental diseases. On physical, we can see, as Nasrin told, case of leukoderma, that we get only one or two symptoms, and the patient is not able to tell, or patient, doctor is not able get the much symptoms from the case. So Hahnemann he started topic with one-sided disease of internal type, of physical type, then mental type. And before internal, he already explains about local maladies. What is local maladies? Injuries, external injuries, external cause. It is not from internal cause.
But when the whole system agrees with the ailment and creates, let's say, an infection or inflammation or swelling, we treat it differently, and then it's no longer a local malady. It can use internal medicine. Fun fact.
Forget to change my these glasses, and I was why am I having a different vision today? Okay. So, what are the aphorisms Hahnemann explains these mental diseases? It's from aphorism 210 to 230. So we are not completing all those, but we will just have look what's aphorism 210. Dikwa, can you just revise that?
Of sporic origin are almost all those diseases that I have termed one-sided, which appear to be more difficult to cure in consequence of this one-sidedness, all their other morbid symptoms disappearing, as it were, before the single great or prominent symptom. Of this character are what are termed mental diseases. They do not, however, constitute a class of disease separate from all other diseases, since in all other so-called corporeal, bodily diseases, the condition of the disposition in mind is always altered. And in all cases of disease, we are called on to cure the state of the patient's disposition is to be particularly noted, along with the totality of the symptoms, if we were to trace an accurate picture of the disease, in order to be able, therefore, to treat it homeopathically with success. So it's just one of many symptoms of the
Actually,
whole person, because it's a
in short,
disease of the whole person.
yeah. Actually, what he means here, in short, it is one-sided diseases, and it is psoric in origin. Huh? And it is not different than the physical disease or other corporeal diseases. As other corporeal diseases also includes change of disposition and mind. So it's not different than it includes, but he says in one-sided diseases of mental origin, you will have to see both whole totality along with these mental symptoms. Though mental symptoms holds much importance, still you have to see whole totality in the case, right? This is uh, the main point what he talks about this in aphorism number 210. He tells mental disease is not different than the other diseases. It's just a sort of psoric origin internal disease of chronic nature, and we have to have perspective same as other disease. So in aphorism 211, he tells how much importance are these symptoms which are presenting in the case of mental origin are important. Can someone read that aphorism 211? Okay.
Yeah, I'll read it. I'll read it. This this holds good to such an extent that the state of the disposition of the patient often chiefly determines the selection of the homeopathic remedy as being a decidedly characteristic symptom which can least of all remain concealed from the accurately observing physician.
Yeah.
Yeah.
He,
So
he's
changes in
talking
mind and
about
disposition.
those symptoms, change of disposition and mind. We need to see change of disposition and mind. He used this term, change of disposition and mind, right? And these are important symptoms, but he is talking about mental diseases, which are internal diseases of one-sided character. Which aphorism are you using, Karina? Which organon?
Yeah, I was going to type her.
Mine is the 6th edition.
Is it? Oh, it's Wenda. It should be
Wenda.
still aphorism. It's aphorism
Is
211.
it same or is it different?
Now she has a Wenda O'Reilly, but it's still aphorism 211.
But
Okay.
the words are different. Like,
Yeah, because
Aphorism
Wenda
num-
updated it and made it a little bit more modern.
oh, I see.
It's a new,
Okay.
new updated and easier to read
I didn't
organon
realize
edition.
she changed the words. I know she's kept her own annotations and descriptions and explanations, but I didn't realize that she would change his words.
Well, what does Wenda say that Hanuman's saying here? Can you
For
read it to
example,
us?
Can you
I'll
read?
read aphorism 210, which was different. It goes like this. Almost all of the diseases that I have termed one-sided belong to Sora. These diseases appear to be more difficult to cure because of this one-sidedness, where all the
Right.
rest of the disease symptoms vanish, as it were, before a single great prominent symptom. The so-called mental and emotional diseases are of this kind. They do not, however, constitute a class of diseases that is sharply separated from the rest of the diseases, because in all the so-called somatic diseases as well, the mental and emotional frame of mind is always altered. In all cases of disease to be cured, the patient's emotional state should be noted as one of the most preeminent symptoms, along with the symptom complex, if one wants to record a true image of the disease in order to be able to successfully cure it homeopathically.
Yeah,
Same
it's
meaning.
same.
Same meaning.
The same thing,
words
but
are different.
completely,
Words are
yeah.
different. Its meaning is same.
Mhm.
And
Okay.
can you read
Yeah.
211?
Yeah. This preeminent importance of the emotional state holds good to such an extent that the patient's emotional state often tips the scales in the selection of the homeopathic remedy. This is a decidedly peculiar sign which, among all the signs of disease, can least remain hidden from the exactly observing physician.
Okay,
Yeah.
meaning is the same.
Meaning's the same then. And so, for example, if we're used to seeing, such and such patient and they come down with an illness and their behavior is totally changed because they're sick, then that gives us, a vital clue to our remedy selection. And then, if that person is usually very timid and mild, and then they're like totally angry and agitated, we're like, oh, well, we can just set aside all those other remedies except for the agitated and angry ones.
It makes sense, right? Because in the time, I think it's just exacerbation of the chronic. It's more in the healthy state, they're more inhibited. So we, even though those symptoms are probably that mental and emotional state is probably there, it just doesn't come out as clearly as say in an acute crisis. I think you see more of those symptoms come
Yeah,
out and it's more apparent.
actually, if you go reading a further aphorism after this 210 or 11 till 230, what he talks in all those aphorisms is just he classified these mental diseases in four different categories. Huh? I'm just summarizing everything together to make things simple to understand. And then he tries to tell us how to treat those categories. Okay, so I will just tell you first of all, in this we see mental diseases are first point as one-sided diseases. As one-sided diseases are soric origin, all mental diseases are a soric origin, right? Then they are not different than rest of the diseases which are a physical origin. As physical diseases, corporal diseases also have change of disposition and mind in them. Huh? So only difference is that in one-sided diseases of mental origin, here these diseases have only few symptoms prominent on mind, and there is no other symptom in presentation,
Which is
especially
rare.
especially on physical level or not even mental level. You will see many symptoms, just one or two symptoms, right? And
Just in my experience, it's fairly rare to have somebody that's so, having such a severe mental symptoms that their physical symptoms don't show at all.
exactly,
Yeah,
and
that's not common.
right from 200 and
I once observed a woman with Alzheimer's disease. She was an older woman at the time, probably in her, I'm going back many years, but I'm going to say maybe like in her late 70s. And she was physically like strong as anything. Nothing physically bothering her, but she was totally out to lunch. And to me, that was the example that stayed in my mind that represents this aphorism.
That's a good example. Yeah, that
yeah,
and things like schizophrenia, where people are just like totally
exactly,
out of it.
that's what Hahnemann is trying to say. uh, it's not a behavior symptoms as we take nowadays people are taking. But Hahnemann tells us take only those symptoms which are changed from previous state,
Yeah,
previous
so
healthy state.
yeah, so it's not so much about the
Yeah.
character or the person themselves, but it's more about their changed mental state, not the personality.
So from 212 to 230, it talks about what are the categories, how these mental diseases are subdivided, and how these categories are to be treated, right? So we will just go over those categories to cut short and to make things more simple. There are four categories. One is somatopsychic diseases.
That's when worry gives people stomach aches.
Somatopsychic disease, then psychosomatic diseases.
Or maybe that's when worrying gives people stomach aches.
Yeah. And third category, the diseases which arise from acute origin, acute
Yeah, let's
disease.
say, right, like let's say if somebody's seen a car accident and they're freaking out, then that's going to be like an acute thing,
Yeah.
and you're going to treat that differently. You're going to probably give some opium or some
And
aconite,
fourth,
but then you have to follow through with an antisporic treatment because, as he says in 121, if the antisporic treatment is neglected, the next time such problem arises may be worse.
yeah.
So when we've had to use something like aconite, belladonna, hyos, stramonium, anything along those lines, arnica, for a mental state, we still need to then follow up with the treatment, never neglect that treatment, and then go
Which
to a more deep
aphorism are
treatment.
you talking about?
Which aphorism? Oh, let me find it. I am talking from my head.
I think it is 223.
Okay, 226.
Okay.
And 227.
Yeah, 223 also tells about that. But basically, and fourth
Oh,
category
yes,
is
223.
mental.
Yeah, it's just kind of a theme. This all makes like a theme, where we just kind of connect the dots and then it all makes sense. But when we read just one piece, then it only has that. But then when you go through the
New
whole
piece.
book, yeah, you connect the dots from the whole book and you get the whole thing of what's going on, it helps a lot.
Now,
I mean, that's really what we need.
fourth
Okay, you
category is,
continue with your categories while I blabble on here.
yeah.
Yes, can I ask Sanjay or somebody to type into the chat the 4 categories, please?
And
Because
Madhu?
I can do that.
Oh, did you share with her your 4 categories?
Yeah, I will show.
No, I'm writing simultaneously.
I just summarize all those aphorisms.
Why don't you just take a picture of it and put it in the group?
Yeah, I will put that, but I cannot do now. Number 1 is somatopsychic, means which are originating from. We will learn that later. Fourth category is mental diseases of doubtful origin. Still, we are not clear about what origin they are arising from, whether they are from corporal origin or whether they are from a psychic origin, a mental origin. or they are from any acute diseases or acute causes. When we don't have such clarity, these diseases fall in this fourth category, and that is a doubtful origin, arising from acute origin. Third, and
And
fourth
then
is
there's
mental diseases of
ways to test which one is which too.
what did you ask?
I didn't ask. I said there's ways to test which is which. Because if consolation helps people, that gives us one
Yeah.
indication. If
That
consolation aggravates, that gives us another indication. So the treatment
exactly that.
methods are a little bit different.
So first category we see somatopsychic diseases, means he's talking about those diseases where disease begin from a physical disease, and by some reason this physical disease goes down, and then mental disease arises. Okay, and I will compare the other disease, psychosomatic disease, where first there is mental symptoms and then physical symptoms we will see in the patient.
Kahneman says here, anxiety, worry, vexation, wrongs, and the frequent
Yeah.
occurrence of fear and fright can destroy the physical health.
Yes.
Can you just imagine or tell any disease that been arising from physical origin, mental disease, how
But
it
can
will
we,
happen?
but can we consider fracture into depression? Like
No,
somebody had fracture and then he was plastered and he
no.
was
I
prayed
will
for.
I will tell you one small example. If some any person is having any physical complaint, any person is having any physical complaint and which is not actually uh, curing or relieving him with any of the medium of medicine he is being using, he has very tolerance of his mind uh, before losing it. So once this threshold crosses that, and when we see that physical symptom are not relieving, it's going long and long and long and time, and then this anxiety and this thing will just hold that person, and this present complaint physical origin will go down now, and new physical disease we will see in the case along with prominent mental symptoms. Or other thing, we will see that physical disease is just suppressed, and we will see an insanity sort or schizophrenia sort of disease is just popping out from this physical origin after suppression. And other, he talks about psychosomatic, a long-standing stress or long-standing anxiety might give you any of the physical diseases like blood pressure or changes, hormonal changes in the body. Women will have cycles issues, periods issues. Women might have thyroid issues, right? And these are just examples you can consider. But what he talks, psychosomatic disease, how we can differentiate a psychosomatic and somatopsychic. It was just told earlier that a friendly talks, if someone is having stress or anxiety, you go and console him or have a friendly talk, he might feel better with that consolation. Uh, and as he feels better, his physical complaints also we see is subsiding. But just imagine the one who is having stomach aches for long, long time, say for 1 month, 2 months, 3 months, and now he is irritable mentally. And you are going to him and just consoling that it will be okay, fine, it will be fine. And he will say, what will he say? What sort of guy you are? I'm having such a bad pain and which is not relieving by any of the medicines, and you are telling me to just calm down. Here we see that with consolation, the diseases which arise from physical origin will aggravate. And other category, we see that with consolation, these mental origin diseases will actually uh, will ameliorate the complaints. They will feel better. And most of the time, we will see that mental diseases with mental origin or any disease with mental origin will not need any medicine, but they will just relieve their physical complaints or mental complaints with friendly talks or counseling or consolation.
Yep, with diet and a good regimen of lifestyle.
Right? Now he talks about third category. The disease arises from exciting cause or disease arises for any acute cause. These are acute type of mental disease. And other earlier two categories, the disease with physical origin or corporal origin. He talks here you need to proceed uh, treat this disease with antisoric remedies. Second category, he tells, doesn't need actually medicine. Your consolation or counseling might help, but if anyone needs medicine beside this, you just might need an acute medicine. And third is also very important category he talks about, and second is also but here he talks about those category which arises from acute disease or acute mental disease from acute cause or acute disease.
I would say that an example there that I like to give is something like postpartum depression. Is that, there's been an acute situation, a woman's been pregnant, she's had her baby, her hormones are totally in flux, and maybe she's, it's kind of like an acute thing, and it still needs treatment, but I like to use that as like a modern day
Yeah.
example.
And it tells that you need to treat these such types of acute diseases with acute medicines,
Like,
not
for example, maybe pulsatilla or
directly
something.
with chronic antisoric medicines. Like you can go with belladonna, hyoscyamus. He has given that 2 3 uh, list of those remedies. Which are those?
How would you, in the case of a postpartum depression, you'd have to differentiate between if the woman has history of it, or if it's just, or if there's, it could be acute, it could be chronic.
Yeah, well, see,
Yeah.
the thing is that I think that trying to categorize things like this into these four things makes it like much harder for my brain than just reading the aphorism, see how everything interconnects, and then just taking the change state. It's harder for me to try to categorize this like this. I don't know. I'm a real simpleton. Oh, I'm speaking too fast. I'm sorry. I just got a message here. Yeah, so
So
I
here,
think that it's more confusing to try to think that we need to categorize symptoms
no,
before we.
it's not about categorizing. I am just telling what Hahnemann had did in all these aphorism. He tells all about this.
But
Just
somehow,
I
in my
summarized.
mind, it's simpler.
Yeah. And in third category, he tells that the diseases which arise from acute causes, acute diseases, these are acute exacerbated diseases which needs only acute medicine. And after they subside, you should go with antisoric remedy.
Unless there's
Because
syphilis involved as well.
it talks about talks in aphorism 200 and 22.
Well, we can take the example of anxieties when there was fear of COVID. There were so many patients coming with anxieties, throat irritation, and lots of anxieties because there was COVID peak in India. Well, we can take that as mental diseases because of acute origin.
Yeah, I see in here what you are
That's
going
the
to treat.
television disease.
No, what you are going to treat, you are going to treat his COVID, or you are going to treat his anxiety against COVID. If you are going to treat that anxiety, just you can go with belladonna like that diseases,
No, it's
right?
television disease. You just unplug the television.
Definitely, definitely.
That's called a exciting cause. And then how to remove that exciting cause, we use aphorism 4. And we turn off the television.
Television, newspaper, WhatsApp, Facebook.
In aphorism 222, it talks whenever the acute mental disease is treated with any of these non-antisoric remedies or acute remedies, need to have and follow up with antisoric remedy.
Yeah, remember that as a takeaway, guys. That is
This is very important.
important.
This is very important because what he talks in aphorism 223 is very important. If we don't treat these diseases with antisoric remedy, what happens? This will have a constant relapse.
And it can relapse
And he
worse.
talks why these acute mental disease arise. They are arising from latent sora.
Yes.
Latent sora.
And
And
so
if you don't treat with antisoric remedies, this latent sora will go more deeper to develop, and it will be then form and developed form, and then the disease arises from that. What? Yeah.
boy, I want to say that when we have treated somebody who needed, let's say, belladonna or aconite or something like that, and if we omit and if we don't apply the antisporic treatment, they can come back sicker and sicker with each event that triggers them. So it makes it go from he talks about it being like an erupting flame of the mental state. You can cool down that flame with a remedy like aconite, but then you need to put out the flame with an antisporic remedy.
Quick question. How much time once the acute attack is over, do we right away treat with the antisoric, or is there a time that we should wait before giving the antisoric or antisyphilitic?
As soon as you can get accurate symptoms.
You go ahead and
You will get the symptoms, other symptom from the patient.
okay.
So I have a picture in mind now on this too. September 11th is the classic aconite story, right? Like everybody in the world needed aconite on that day. But then what you're saying is after that day is over and everybody's had their aconite, now go take their case and find their antisporic remedy to clean up what triggered their intense reaction. Is that what I understand?
Yeah.
But some of that reaction was normal because it was really, batshit crazy, right?
Right.
Yeah. So it depends on if it persists. If people were just like suddenly shocked, that's normal. But if it persists, then it's problematic. Or if people are like actually hysterical.
But we're talking about this acute situation. It's an acute situation for the whole world. That was an acute moment. Some of us, like myself, I probably had a delayed reaction to it because I went into panic attacks like a month later. But what I'm saying is, but we all have like our own inner stuff. It doesn't matter what it is. We all have our own inner stuff. So after the acute is over, now you have to deal with your own stuff because is he saying that the acute will affect us in our normals, in our whatever our state is? I mean, am I making myself clear on what I'm trying to
No,
say?
see, whatever situation you are going in, you are not, it will affect, your surrounding will affect your personality, how you are built, how sensitive you are to an external stimulus. Right?
I think it also depends on the susceptibility, right?
Exactly,
So
exactly.
Right.
I actually, like, I remember 9/11 like it was yesterday because I was supposed to get on a plane and go
Right.
across the United States on that morning at 8 o'clock. The only difference is instead of going from the East Coast to the West Coast, I was going from west to east, and I was delayed by a couple of hours. So I think it's how you react to that, whether you actually needed aconite or not. Because I was calm for whatever reason. I was just, and I was right near the airport, and they barricaded us, and I was just patiently waiting through it. So I think for whatever reason, maybe I blocked it off, or maybe I have some other issue to
And
work out.
one more thing we need to understand how long this effect is going to stay.
Okay.
If you are having any anxiety or fear or panic attack, it's very common to have people go into a situation like that, but automatically body is coming out from that situation, that with the time. If it's taking a long duration of time, as such consideration is very long, then you need a medicine. Not every time you might need medicine. If it's taking very short, hour, 2 hour, or 3 hours, it's okay. But if it's taking weeks, months, or if it's interfering your activity, your life, then you might need an medicine.
So I have a good example of this case. I had it a couple of years ago. This patient would only come to me when she had anxiety. She suffered anxiety all her life. And the anxiety would make her extremely nervous. And I would give her, at that time, I was treating her with the anxiety as well. And it always came up like arsenicum symptoms. And I gave her arsenicum. And it really wasn't working. It kept going on and on with the acute anxiety attack. Once she called me and it was close to midnight and she described the anxiety and it was so sudden and so intense that it seemed clear like it was an aconite situation. And I gave her aconite. But the difference with this patient is she actually did come back after. That's why I asked you how long should we wait? Because she ended up coming back to me a month later, and it wasn't for herself, it was for her son. So what I did was I took her case as well, just because she didn't want to come to me at that point. Her anxiety was over, her acute crisis was over, and she was going on with her life as usual. So she didn't have the need to come to me. But her son did. So we ended up taking the case for her son. And then I asked her, so how are you? And symptoms came clearer at that time when there was no acute, and it ended up being carcinosis. That was the follow-up, and then that was her remedy that she continued. And we've been on 2 doses. It's been 2 years, and no acute anxiety attack. So
Right.
yeah, definitely, I could relate. I mean, I didn't realize I was applying an aphorism until now, but it definitely worked really well doing it that way. No more acute anxiety attack.
That's great. Yeah, so aconite is really like a real go-to remedy for that kind of PTSD state. Even when it's happened like, years prior, that aconite might still be needed.
In 222, we see that the acute, this whatever we are treating with non-antisoric remedies or any acute remedies, we need to have follow-up with antisoric, right? We need to finish the case with antisoric.
However long
if,
as that may take.
yeah, and in next aphorism, he talks about if we don't treat these cases or if you don't give antisoric in such cases, then what will happen? It will just flare off their latent sora, or it kicks that latent sora and it will develop into and full miasmatic disease, and which will constantly coming back having relapse, and this time this disease will not be able to cure, or it will be very difficult to cure with antisoric remedies. So to avoid this dead end of treatment, it tells us to treat all those diseases which needed acute remedies should be treated or with antisoric at the end.
Yeah, it says in aphorism 227. Can we read that?
Yeah.
Okay. But if the fundamental cause in these cases also is a sporic miasm, which was not yet quite near its full development, and for security's sake, the seemingly cured patient should be subjected to a radical antisporic treatment in order that he may not again, as might easily occur, fall into a similar state of mental disease. So that kind of touches on what Francine said, that if we're not sure if it needs treatment, for security's sake, we can go ahead and treat it anyway, deeper.
Yeah. And in the fourth category, when there is a disease and we are not clear about what origin the disease is coming from, it's doubtful origin. We don't know whether it is from corporal origin, or whether it is from mental origin, or whether it is from any of acute origin. So what should we do in such cases? We just take all those symptoms and treat this disease as rest of all miasmatic disease with an antisoric remedy, a constitutional treatment. But overall, what we see, he tells only mental symptoms or only physical symptoms will not complete the picture. To have an well selected simillimum which covers whole totality, which is on physical as well as mental. But when he is talking about one-sided mental disease category, he tells us mental disease which are prominent are of important nature. And this holds a very important picture in all disease state. If these symptoms are a prominent one on the mental sphere. In short, these are psychic diseases. We have a change picture of disease, overall change picture. You can call psychosis or schizophrenia or mild or any bipolar, whatever, severe or mild, whatever. But these all psychic diseases are having a physical origin, corporal origin at the background. They are not alone a mental origin. Disease arising from physical cause, mental disease arising from physical cause are more dangerous and more difficult to treat than diseases arising from mental cause. He is telling diseases arising from mental cause are more simple. They don't need much medicine. So, what he talks about lucid interval in aphorism 219 Tikva.
Okay, yeah, so when you've got a patient, you want me to read the aphorism? You want me to
Aphorism
read the aphorism?
219.
I know, I was going to summarize the aphorism, but I'll read the whole aphorism, then we'll talk about it.
You can just tell us a summary and
Okay,
make us
so
understand.
when we have a person who has, and that they're not okay in their mind, sometimes they will be lucid, which means that you can like talk to them and find out what's going on. When you have the lucid interval, you want to try to ask them about their previous physical problems in order to give them an antisporic remedy.
Yeah.
So let's say you've got somebody who's like really manic and they're not really communicative. but then they just kind of like, they get a little bit better. Then you can then at that time when they are lucid, which means like mentally available, you can then talk to them about the kinds of symptoms they've had previous to this new mental situation.
Right.
You
Lucid
can also
interval
ask,
is
you can also ask the friends and family members about the previous physical complaints of the patient.
exactly. And one more thing, Hanuman is one side telling us to get symptom from these relatives, friends, his attendance. And on other side, in one aphorism, I don't really remember now, he is telling you, us that these people might mislead a physician. They might not always tell you the right symptom. Physician should have a vision to make that discrimination, to look at the original fact of the totality. In when you are about to see an mental case or a mental symptom, not always one side he's yes, the surrounding friends relatives might tell you some symptom, but on other side he is telling physician, just don't rely on those people, you should verify that totality yourself. You need a vision, you need an observation yourself.
Observation is your really big friend here, because when we see the behavior, the physical appearance, different ways that people move, act, behave, gesture, the things they say, the tone they say it in, all these things give us clues that can be very, very important.
And in short, a lucid interval is that interval. He has a one panic attack this side, second panic attack this side, and between that phase, there is a huge gap of a normal uh, his behavior. There is what was the question?
For example, in a case, we get the both symptoms, psychosomatic and somatopsychic symptoms mixed in a case. How to treat? Whether which one need to be treated first?
See what he is talking about. He is talking about the category first. He is talking about these one-sided diseases of mental origin. Okay. Now he has divided that mental disease category into four. One, the mental diseases which arise from physical cause. Huh? He tells us to treat those diseases with an antipsoric remedies. And you should need to consider the whole totality. Second, he talks about the disease which mental disease which arising from mental cause. He tells we don't need much remedy in such case. Often you will see symptoms are subsiding with friendly talks or consolation or counseling, and whatever remain might need some short acting remedy, right? So how you judge the patient will have only both the category mix.
So physical, mental, physical.
Or we could treat the presenting state.
Yes.
Yeah. And that's what he is talking about in aphorism 210. He tells, yes, this is a category, but as homeopath, this is not different, or it is from a rest of patient or rest of diseases. He's just putting weight on whole picture of the case, weightage on the whole picture. Though prominent symptom we see on the mental sphere, but we need to look at other symptom also.
The big picture.
Only mental symptoms, you cannot treat such cases. And the disease, mental disease which arising from physical cause, it's need full focus, full means what you call skills of physician to treat this case, because there was a very long standing physical disease and it's been suppressed, or it's not now, it's decreased, and now what you have is only a couple of mental symptoms. Patient is not in the state to tell you those previous physical symptoms, because he is mentally unstable,
And how
right?
can we take the totality?
So here Hanuman talks about relatives, friends, attendance, to get that totality also. Though it is not present right now, it disappeared, but it's not cure. It will go after you give an antisoric treatment.
It
Right?
means that the patient presents with few symptoms, and we should not only consider those few symptoms and prescribe the remedy on the presenting state. We should
No, you
consider.
cannot give like that. You cannot go like that. Sometime you will get econite.
Hmm.
Sometime you get belladonna.
Hmm.
It will not cure. Only 2 or 3 mental symptoms. Have you seen that mental case actually bipolar or any schizophrenia?
Yes.
One day it will present this, and second day it is totally different this.
Yes.
And what you will consider now? And third day there is a lucid interval.
I gave on the totality, not on the
Uh,
present.
I had one such patient once. Oh, absolutely mind boggling. And she wanted to have an appointment every single day. And it was always different. It was it was really, really challenging.
And Hanuman here in this category is not talking about those behavior symptoms. We need, I'm making it clear again. He is not talking about personality. He is talking about change state. Means these mental diseases are a disease state of that person. It's not an regular behavior of this person, the regular character of this person. It's totally a mental symptoms or mental disease, right? I'm confused. क्योंकि actually everyone is teaching that okay, this all this um, mind school are teaching 211, only one part, and just randomly giving all on the only mental symptoms, and those are just how he behaves, how he reacts, how he, and it's really difficult.
So can I summarize what I understand for a moment? Because this is
Yeah.
something that's always gone through my mind too. We talk about the change in symptoms, and you're now, if I understand you correctly, clarifying that when we're dealing with somebody who has a one-sided mental illness, we are only focusing on the change in their state, not on their personality, their characteristics. But now let's go back to the person who is not in a one-sided illness or situation. And you have some mind symptoms and you have some physical symptoms, which is most of what we treat.
This is our most common cases.
Our most common cases, right? We take into consideration, not as symptoms, but as remedy selection, their characteristics.
Yeah. See, there also, what you are talking about, if someone is a mild nature, he was mild and now he is irritable. Why he should be irritable now? Someone is having a headache, someone is having a stomach ache, and he is not able to focus his work. He is not able to do his routine. He is irritable, or he might be weeping in the pain. He might be having some delirious symptom with the pain, right? And usually he is not having that symptom. He is not irritable, or he is not weepy in his normal state.
I think that Francine is trying to ask, to what degree do we look at the personality of the person in our remedy selection?
Yes.
Thank you.
Yes,
Yeah,
that's what she's asking. Okay, Sanjay?
yeah. Personality actually might affect a little bit if that person is too much susceptible for impression.
See, like myself, I don't really, I try to like for example, Jar says about how we should try to separate people's sick days from their healthy days. There's all different kinds of ways to approach this kind of thing about, the personality or not. I don't factor personality much into my case taking at all.
No,
I,
actually,
go
what I
ahead.
mean, what I mean is that if suppose you are sick now and you are in healthy state, right? And physically you are sick now, and how your mind works in that sickness, during the sickness, is more important. Huh? How our mind works during healthy state, and how it change from healthy state to how it works during sickness. That's those symptoms are more important than the personality symptom.
Okay, thanks. I'm clear about it now.
There's a fine line there,
Yeah, and sometimes
disease and personality.
Personality,
and
see,
sometimes,
personality is just Shivkumaran has just told, it's mask. You are not original. You can just have an face over your face.
Right,
How do
but
you
sometimes
sustain that?
personality, I think sometimes where it gets cloudy for me or for some of us, it's when personality becomes more exaggerated maybe even, or more
Yeah,
part of the
yeah,
case.
yeah.
Personality
But
is
during
not a
sickness,
origin.
yeah,
Personality is not your originality, sir. So persona means mask. It's meaning itself. So we have to treat personality also, na. That's what my question.
okay.
Can I say
And
something?
one of the things, oh, go ahead, Madhu, I'm sorry. Go ahead.
Madhu?
I just wanted to say that what I've understood, that whatever patients comes with the symptoms, like acute state, we have to treat it first, and then we can take the concentration of the personality. Like this acute state, the patient comes with us, not acute like the chronic and the long continuing symptom. This is the presenting one, and we have to treat presenting first and then go back to the personality. Is it right?
See, yeah, yeah.
Because
Whatever
the
disease you are
personality adds
treating, whatever disease you are treating, the latest symptom you have to treat first, right?
like the personality, we
Ah,
decide on taking the case, we decide, okay, this is the particular personality. But now the patient is presenting with the nux vomica symptom. So instead of giving the pulsatilla, we should give nux vomica first, and then decide whether to give pulsatilla or not. Or we should give pulsatilla and antisoric treatment at the end.
no, you have to treat the presenting symptom first.
Hmm.
Here he is talking about mental diseases which are falling under category of one-sided diseases, right? Here means this there is no other symptoms. There is no other physical symptom or mental symptoms. You will have only couple of one or two mental symptoms in this category. They might be from physical background, the disease which is now disappeared, or it might be from mental origin, or long-standing anxiety, huh? Or long-standing stress, whatever, right? And here he tells about treat those symptoms with antisoric remedy, both categories.
But here in one-sided, we don't have
But
much.
but in second category of mental origin, he tells such diseases might not need a treatment at all.
Mhm.
80% of disease will go like that with your counseling, or only 10 or 20% might need treatment, and that could be a simple, either acute, and but he tells you need to end treatment with and antisoric remedy. If you won't do, then this acute flaring of disease will go more deeper to develop and full psoric disease. And now this psoric disease will be very difficult to treat, even with antipsoric remedies.
Yes.
Then you should not blame homeopathy.
One of the things that I like to do when I'm treating somebody is ask them if they remember how they used to feel before they got sick, what they used to be like, in order to see if there was a change in personality.
Yeah.
Yes.
You know, do you remember before you got sick, what was, you know, how were you then?
How he reacts during sickness, how he responds during sickness. how he adapt sickness mentally, emotionally, huh? How he functions in sickness is more important.
Sir, for example, a person is generally getting more anger. For he working as a clerk to his boss, he acting with always smile. Yes, sir. Okay, sir. Like
Yeah.
that, he acting. How to
Yeah,
treat?
he is trying to please the boss and he is constantly on that stress. It's long standing stress. Yeah.
That comes because he wearing a mask with his boss, na. So
Yeah.
because of that wearing that mask, he get some stress and disease, na. So how to?
Yeah, that's a good point.
Yeah, that a good point. And he tells, see, when you get a mental disease, how this our brain functions. Um, Basically, it itself is physicality. Mind itself is physicality. It's function of brain. Huh? And now you have a little bit and bit of that intelligence and how you function, how you respond to and surroundings. Here he is talking about that clerk is constantly try to please and his boss. He's try to do those things that other or his seniors like. Probably he might not doing his what he likes. He is he might get and that chronic type of disease because his body will not function according to his will. He himself is not functioning according to his own will. So it needs an antisoric remedy, a deep acting remedy. You need to consider all those symptoms. His anger is not from the disease itself, but it's from he is not happy with himself.
When I have a question. When we treat acutely for the presenting symptoms of that moment in time, but if those presenting symptoms are indicative of a deep acting remedy, for example, person who's unwell, or for example, in a postpartum depression, and it's an acute situation, but it's indicative of sepia, which can be a deeper acting remedy. Um, but sepia is not the person's constitutional remedy. They never suffered those symptoms prior to postpartum depression. And if we give sepia, and it's a deep acting remedy, would it act acutely for that person? Like how does that work for that individual when we give a deep acting remedy for an acute situation? How does that work?
Well, that'll balance out the hormones and probably just sort out the problem. For example, like let's say that you have somebody who miscarried in their second month and now their hormones are awry and they're really irritable and they just kind of like laying down all the time and they're not interested in their life, then you do probably want to give them sepia. And then when they get better, then you continue the treatment as needed. Because, especially if there's been like more than one miscarriage and there's a
Whatever
history of
remedy you are
miscarriage.
choosing, whatever remedy you are choosing, huh, if the symptoms your present state symptoms are matching exactly, accurately, that remedy will work. But
And when if you were going to follow it with an antisoric or an antisyphilic remedy, does that remedy need to have a relationship with this acute remedy? Does it need to be a complement, or does it really matter?
It may help to use the concordances, like, Devera showed us, I think. And, but it doesn't have to.
Okay.
It doesn't have to. It can be its
but
own thing.
you need to choose the acute remedy for the situation, acute situation. That's a basic point.
Isn't what she's describing in sepia an intercurrent remedy?
Karina?
Sorry, what's your
Like-
question?
No, I'm saying, I'm just trying to clarify it. It's saying, if I followed you correctly, that the sepia became an intercurrent remedy. And
Right.
then treatments continued afterwards.
Yes.
It can
So
use
just
as
wanted to
intercurrent remedy.
Mhm.
when we talk about acute remedies, we're talking about aconite and belladonna, but sometimes the cases or the presentation of the symptoms are not always an acute, really quick remedy. Sometimes I feel they're indicative of a deeper acting remedy, and I didn't know at that moment in time if we gave a deeper acting remedy during an acute crisis. And then if we follow it with the deeper antisoric remedy, if we needed it to have a relationship to that acute remedy or
Yeah,
the
yeah,
acute
yeah.
remedy. Okay.
That would be a maybe, maybe not.
Okay.
No,
Follow what your patient
if you
gives you.
have an symptoms, if you have symptom, whatever remedy will coming up will work. But you
Follow
need
the
to
patient
track the symptom.
signs.
You need to have an symptom. You cannot give any remedy without having symptom. That's a basic rule. You just cannot antidote any symptom without having just assuming that coffee or a camphor to give randomly as antidote.
I've
Whatever
never seen
symptom
it work.
whatever symptom you need to antidote, that remedy, whatever remedy you are giving, should have those symptoms. Then it work. Otherwise, it will not work.
You
That's
lost me there. Anybody else lost now?
Yes.
Okay, so
Ma'am.
Karina says if we need to have, okay, we have a postpartum case needs sepia. Okay, good, we give sepia. But it could be that 6 months postpartum, that something else might arise. And then maybe there's another remedy that's indicated. They don't need to necessarily be a concordant or anything like that, but we can just give the presenting new situation. Like
Right.
maybe there's lack of podiums needed 6 months after the birth. It's possible. This
Then how-
happens.
Yeah.
Then how
And
to give
her question was like that. Her question was like that. In an acute situation, when we get an simillimum deep acting remedy, should we give this deep acting remedy or we need to choose an acute remedy?
We can give that deep acting remedy for sure.
Exactly. We can give that remedy also if we have a symptoms, right?
Okay, now the postpartum situation is gone. Postpartum depression situation is gone. And for every case, we need to give the antisoric remedy to complete the cure. And now she does not have any symptoms. Then how to give the antisoric remedy now?
Well, since sepia is an antisporic remedy, you're partway there. And it's rare that somebody is going to be totally cured and have no symptoms at all, you know, with 6 months of treatment.
Okay.
It's unusual.
Francine need to leave now.
Bye,
Okay, Francine.
everybody. Thank you
Yeah.
so
Hi,
much. I
Francine. Thank you for
appreciate it.
coming.
See, maybe I'll see you next week. Hope to see you next week.
Okay, I
Yeah.
hope so too.
Thank you for coming.
Thank you for
All right.
coming.
Thank you. Bye-bye.
Bye-bye.
The other question that I have is, I was looking into a case earlier last week, and it seemed like a very Cali carb situation. But looking deep, it's one of the remedies that almost has a warning not to give during an acute bout. And it was the first time I came across that, not to give Cali carb during the acute, you will send the patient worse off, even though the symptoms match. And it was, I think it was in the Materia Medica, and it said it's better to give an acute remedy like Ipecac or Belladonna, whatever the symptoms present, but not Cali carb. Now,
Well, what's
why?
the illness?
There's acute and recurrent acute attacks of colitis, and the symptoms match with Cali carb in addition to the other presenting symptoms. So the other presenting symptoms are routine oriented, the color of the vomit, the bile, everything was matching to Cali carb. But during the acute situation, the acute bout, nausea is the highest symptom, the symptom that is the most troublesome. So when the nausea goes away, the pains are bearable. And these acute bouts of colitis occur in a span of every 3-4 months. So they're very chronic in nature. When I took the mentals and the emotionals, it seemed very, very Cali carb. Even the what if questions and what if this happens and what if that happens. But it was very clear, do not give it during an acute bout. And so at that time, I prescribed Ipecac because of the nausea, and it resolved the situation very, very quickly. And I did follow it with Cali carb, but I haven't waited long enough to see if it has had a long-term effect. The few months for the next attack hasn't happened as yet. But I wanted to ask, is that only unique of the Calis? Is that only unique of Cali carb, or do some remedies fall under that category where you are not supposed to use them?
I
during an
think
acute
potassium have that character to it acts little bit delay.
Okay.
Probably it might not give you a result very fast in very acute condition, very urgent condition.
And is that only unique of potassium of the Calis, or are there other remedies that I'm not aware of?
No, probably potassium, all Kali is Kali carb or Kali group.
Okay.
So, but Kali might give results in acute condition.
Which
Chromium.
still it takes little bit time, but very urgent conditions it not work that fast like
Well,
other remedies.
let's say somebody has a bad burn and you give them causticum. That's an acute situation and it'll work beautifully. It might
Burn,
depend on the circumstances. I don't know. Because causticum is a Cali and it will work in an acute burn. I don't
yeah,
know if
but
these things are totally
causticum,
tried and true.
if you look at causticum in burns, it's actually for that contractures formation, which to avoid that thing. After burns, everything is just forming that scar.
You know, Karina, every once in a while, there seems to be like some kind of mythological thing that gets, yes, Devera, causticum is part
No,
of the calyx.
mm,
There seems to be like some mythology that gets passed on, like the trios. The trios, we may or may not see the trio instead of the presenting state. So I think that there's a little bit of people say this and they pass it on to each other and then they say that, and kind of like that old game of telephone. And I'm not sure how accurate all these little tips are. I'm not sure,
Actually,
but you did a good
it's
job though, Karina. That was good work.
I'm still waiting. I'll keep you guys posted.
Sir, fourth one, mental diseases of doubtful origin needs to be
yeah.
explained.
He tells that you need to take a full totality, full case, whatever symptom probably you are getting, along with those prominent mental symptoms.
Can we take it as illusion or false belief, like delusion, like that?
Whatever symptom you have, because you have symptoms. See, any bipolar, you have different mood swings, or you have this delirious states. You can consider whatever symptom you have.
Bipolar comes from mental diseases of doubtful origin.
No, no,
No,
no.
no, those are physical
No,
origin.
you cannot category like that. One disease can fall under any of these category. Not necessary you should have only this or that category.
I think I need more explanation regarding mental disease of doubtful origins.
No, I think it is from 227, I think. What is Tikva?
Oh,
27
I
to
got busy
30.
looking for something
4,
else.
5, 4, 6 aphorism it has given. And
Which one?
everything tells that
I got
it will be
distracted. Which
treated with
aphorism do you want?
full case taking. Actually, consider everything, whatever you have. You cannot give the remedy on a single. Yeah, Tikwa?
All right, do I want to know which aphorism you wanted? I got distracted doing something.
No. I am not able to find, but
Mental disease
I
of
think
origin.
it's
Aphorism.
from 200 and
I didn't study this chart.
26. No.
Sorry, I got distracted. What are we looking for?
Aphorism for mental disease of doubtful origin.
Doubtful origin.
Aphorism.
We're looking for the aphorism, is it?
Yeah. I think it is 220. 24. 224.
If the mental disease be not quite developed, and if it be still somewhat doubtful,
No.
Yeah, that's it. That's it. About bad practices, corrupt
Yeah.
morals, neglect of the mind, superstition, ignorance. And it'll get better with
Yeah.
talking nicely to the person.
224, right. But it explains treatment part also in the aphorism above 226. And it tells only that either you have to give antisoric remedy, either you have to give an acute remedy, or you need to take a complete case with all modalities and
can I read
everything.
that 226?
226 and 227.
Can I read that?
Yeah, you can read.
It is only such emotional disease as these which were first endangered and subsequently kept up by the mind itself, that while they are yet recent and before they have made very great inroads on the corporeal state, may by means of psychical remedies such as a display of confidence, friendly exhortations, sensible advice, and often by a well disguised deception, be rapidly changed into a healthy state of mind, and with appropriate diet and regimen, seemingly into a healthy state of the body also.
What does it means?
So the emotional, it is talking about the emotional diseases. That means we can talk psychosomatic.
It's talking about psychotherapy,
Hmm.
counseling,
Yes,
a friendly and
sensible
skillful
advice.
deceptions. What is that she's talking?
Hmm?
So I have it written a little differently. I think it's easier to
Okay.
understand.
Yes, sensible
Um,
advice.
It is only these emotional diseases which were first spun and maintained by the soul that allow themselves to be rapidly transformed into well-being of the soul by psychotherapeutic means, displays of trust, friendly exhortations, reasoning with the patient, and even well-camouflaged deception. With appropriate living habits, these diseases apparently also allow themselves to be transformed into well-being of the body. However, such approaches will be effective only if the emotional disease is new and has not yet deranged the somatic state all too much. So that is number 3. That it is more
It's talking about
the therapy.
psychotherapies.
Yes, that they're better with consolation, so that's all you may need, but only if the emotional disease is new and not yet deranged the
A
somatic.
somatic disease.
Yeah, it hasn't deranged somatic
Means
state also.
here you will have both symptom, mental symptoms and as well as physical symptoms also.
Yeah.
Sir, super, sir. Thank you very much. And before conclusion, I want to know a basic question, sir. What is meant by mind?
Mind is function of brain.
Where is located, sir?
Nothing. It's just a function of brain. As stomach has function, as liver has function, mind is function of brain.
Okay, thank you, sir.
And you mean like how he talks about mind and disposition? The mental state, the mood. Hmm.
I
Is there
don't.
any definition for mind in homeopathy, sir?
What?
Is there any definition for mind according to homeopathy, sir?
No. There is. I don't think anyone has given any separate definition for mind.
For example, few months back, a patient asked me, sir, because in allopathy they said, as you said, the functions of mind, brain is mind like that, and in spirituality they are saying something. It's mind is nothing but extension of soul like that they saying, and yeah, patient friendly asked
Ah,
me,
yeah. In
what is
spirituality,
no.
it's a different category actually.
No, sir. Question is that patient asked me, what is really what is mind according to homeopathy? He asked. So I don't know the answer. That's why I am asking.
Yeah, it's
Well, he says it's where
difficult.
the anatomist and the materialist won't find anything.
Ma'am?
And when you talk about spirituality, mind has been divided into 80 different parts. It's really difficult, but whatever, as according to the homeopathy and this science, it's just an physical one,
uh, when I
material
explain
one.
to the patient, when I take the case and take the mental symptoms of the patient, the mind symptoms of the patient, he asks me, why are you asking me so much? Then I have to explain him that every person is thinking is different. They react to different situations. And I want to know how you react to situations like in stress level, when you have fear, what is your decision making? And this will help me to decide the remedy. So this is my explanation to the patient.
Yeah. Okay. Anything else?
Yes, sir.
Elena?
One more question, sir.
Yeah.
For example, patients comes in two sorts, sir. Like some patients comes some mental changes after getting disease. This is one category. In another category, some patients getting disease due to change of mind.
Yeah.
Uh, so which one need to give more importance, sir?
See, what Hahnemann tells in these categories, which is arising from physical one, he tells this physical symptom will disappear simultaneously as mental symptoms will arise. Or emotional symptoms arise, physical symptom will disappear. And sometimes in between you might see both, but he says these symptoms which are based upon physical origin will be difficult to treat, but you need to treat those symptoms with proper antihistamic similimum.
In our
But
average case
your
taking,
question, your question, these mental symptoms means presenting symptom should be given important.
Okay, thank you, sir.
but not
And
necessarily more importance than the bowel symptoms. It's just that you can cross
if you
various
have an
remedies
physical
off
symptom,
the list. Right.
if you have
I'm
an
saying the average case, your average case that comes to you is going to have physical symptoms, the main complaint, and it's going to have a mind and disposition symptom. And that mind and disposition symptom can clarify which remedies we will exclude.
yeah,
And that's just in your everyday standard kind of patient thing. When we're talking about mental illness, like we're talking in the majority of things here, like we've been talking tonight with these aphorisms, that's a totally different animal. You know, we do different things. When we're just have our average patient that has, you know, a little bit of anxiety or a little bit of depression or a little bit of, you know, problems that everybody deals with in their life, then we don't really so much focus on that because it's not a mental illness. It's just part of their mind and disposition. And of course, that's important. And we can select remedies because, you know, certain ones will be excluded by a certain state. Like you'll have the anxious remedies, or you'll have the morose remedies. And then, but it's just one, all of the greater whole of the person and who they are and what they're experiencing in their life. So it doesn't really necessarily outweigh the fact that they have to go to the toilet once an hour, you know, every day. That might be more important than whether or not they feel moody. And then, of course, we have to define what do they mean? how and why and when and since when. And, you have to just really dig in there and see what's really going on. But yeah, with our average case, there's going to be a mix of physical, spiritual, mental, emotional. There's lots of different planes.
Okay. Madhu, questions?
No.
Karina?
Yeah, mute.
I'm muted. Yeah, I'm good. Thank you. No questions right now.
Karina actually sits so still. We need to see whether she is awake or she is sleeping.
And she appears awake to me at all times.
There we
No,
go.
she doesn't
Uh-huh.
move at all. Doesn't move at
Karina's,
all.
yeah,
Wow.
she sits nicely in her chair.
Yeah.
We're students learning, so.
And she has to learn early in the morning, right? Getting out from the bed and sit on the chair.
It's
Yeah.
good. Starts my day well.
You can just turn off that recording now.
Turn off the recording.
Yeah.
Okay. I'm trying to turn off the recording.
You're I think I
It's
should.
my mouse. It's my mouse.
Okay, I will do it.
No, I got it. I got it. I got it.